Lumbar disc herniation, or LDH, is a common condition that often causes significant lower back pain and nerve symptoms. Traditionally, when conservative treatments like medication and physical therapy fail, patients may undergo endoscopic spine surgery, a minimally invasive approach designed to relieve nerve compression by removing herniated disc material. However, what happens to the discs in the segments next to the operated area? This is where our story begins. Recent research has shown that, surprisingly, some herniations in adjacent segments can actually shrink or even disappear on their own after surgery. This phenomenon, known as spontaneous resorption, is gaining attention for its potential to change how we manage patients after spine surgery. Let's explore what this means for patients and clinicians. In a recent cohort study, 91 patients with single-segment LDH underwent endoscopic surgery and were closely monitored. They were divided into two groups based on MRI findings, those with herniated discs and those with bulging discs. Over the course of a year, both groups showed significant improvements in pain and function, as measured by standard clinical scores. What's truly fascinating is that MRI scans revealed reductions in disc height and herniation size in adjacent segments, not just the operated area. Younger patients, those with smaller protrusions, and those with better spinal alignment were more likely to experience the spontaneous resorption. These findings suggest that, for some patients, the body's own healing processes can play a major role after surgery, potentially reducing the need for further intervention. So, how does spontaneous resorption actually happen? Scientists believe several biological mechanisms are at play. First, the body's immune system recognizes the herniated disc material as foreign, triggering an inflammatory response. This leads to the growth of new blood vessels and the arrival of immune cells, which help break down and clear away the disc fragments. Additionally, the disc material itself can lose water and shrink over time, especially if it's rich in nucleus pulposus, the jelly-like center of the disc. Endoscopic surgery may also create a more favorable environment for this process by reducing pressure and inflammation in the spine. Understanding these mechanisms helps doctors predict which patients might benefit from a conservative watch-and-wait approach after surgery. Discovery that adjacent segment herniations can spontaneously resorb after endoscopic surgery has important implications for patient care. For those with mild or no symptoms, doctors can confidently recommend conservative management, avoiding unnecessary additional surgeries. This approach not only reduces risks and costs, but also empowers patients to trust in their body's natural healing abilities. However, it's important to note that not all patients will experience resorption, and careful monitoring remains essential. Future research will focus on identifying biomarkers and refining imaging techniques to better predict who will benefit most from observation versus intervention. As our understanding grows, treatment for lumbar disc herniation will become even more personalized and effective.